vein in his body to inject himself. He couldn't find a vein only on his private part. He injected the vein that was on his private part because there was no any other vein in his body. Heroin, inject yourself through your vein. But most people who are more addicted in it, they like injecting themselves from their neck because they want it to start working instantaneously the moment they inject themselves.
Harm reduction is about reducing the health risk of not only the person who uses drugs, it's also about the health of the general population. So harm reduction is one thing we need to look critically into, both in principle and practice, in our response to drug use among people who use drugs in Nigeria. We need to look at how do we protect people who use drugs from harms related to drug use. How do we keep them safe? How do we ensure that people who inject drugs are not sharing needles, they are not sharing syringes, they are doing it within a safe environment? These are the things we need to look into and consider a priority, because not only about the health of the individual who uses the drug, it's also about the health of the general population.
Let's say the truth. The truth is that these area boys that use drugs, they don't know exactly the content of what they use. What they use is highly adulterated. That's why we say that to reduce the harm that comes along with drug use problem in Nigeria, because these harms cost government, cost the people money. It's just that we have not sat down in Nigeria to adequately assess and estimate or determine the amount of money that it costs government. How much do we spend on drug abuse problem in the health sector? How much does it cost the society, the parents, the community? What I would recommend to government is that I think we don't have enough treatment and rehabilitation facilities for drug abuse in Nigeria. We have a population of 160 million, about 160 million. Our activities are still essentially hospital-based, especially psychiatric hospitals. It should not be so. It is not like that in developed countries. We should allow non-medical facilities, encourage or even establish non-medical facilities as treatment and rehabilitation centers. So the more of these that we have spread all over the country, maybe to the towns and villages of the country, the better for the system. And of course, this has to be associated with or accompanied by training. We have to train and provide personnel so that these treatment facilities will be providing quality service to drug users. So I think we need more drug abuse treatment facilities. And I think seriously that those who use drugs should be encouraged to come for treatment. The system should provide an avenue that will facilitate their own enough to come for treatment.
My recommendation to the government on policies and programs is this. First of all, we need to have a drug policy. 2, we don't have any classification of drugs in Nigeria. How do you classify a stimulant in Nigeria? How do I say it's a class A drug, class B drug, you have a class C drug, you have the EED. So you know the ones that are soft drugs, you know the ones that are hard drugs. So likewise is the donors too. You know, the international donors. We don't have donors that actually are sympathetic by giving grants or writing grants, you know, for drug users.
Young people who use drugs face exposure to HIV, hepatitis, tuberculosis, and other forms of illness. I think if there's anybody to be blamed, it should be government. The government are supposed to take major challenges on security level not on the people that use it, but people who import and sell those things. Someone might be moving with one wrap of Indian hemp in his pocket. A policeman is going to arrest him, harass him, take him to the cell.
That aspect of the law needs to be looked at again, the issue of possession, because you really cannot, in the first place, you cannot use cannabis unless you possess it. But possessors sometimes, they serve as tools for investigation. They take you to where they get these things from. But like I said, if you arrest somebody who is possessed, who is like taking 2 to 5, 10 grams with him, and he's a user, and you can identify him as a user through tests and other things, it's really not cost effective to go through all the whole hog of investigations, all those things, until you get to the last level before you maybe grant him on bail.
My opinion concerning drug use and punitive measure is that, for instance, if we're looking at the end user, that's the victim, the consumer, then I will support treatment rather than punitive measure. The end user is the person that sustains the supply, because if it's the person that sustains supply through demand, because if there is no demand, there's likely not going to be supply. But you find that in these aspects where treatment is not given, it is likely that the end user will continue to use, helping the supplier to continue to supply. But if we focus on treatment, then you will find that as you treat the individual and the individual abstains or reduces use, then by and large is going to reduce demand. And if there is no demand, suppliers may have to look for alternative measures. So I prefer where government will focus more, or even stakeholders will focus more on treatment, because that target group will need treatment in order to reduce demand, and that will help us in the area of supply, especially for the producers.
In my honest opinion, I feel our drug law and policies and programs need to really be reviewed. We have a drug law that came into being about 21 years ago, that with an act that established the NDLEA, the Narcotic Control Agency in Nigeria. But for over 20 years, so many things have changed over 20 years. So many things have changed even within the, in terms of drug use, in terms of concerns, public health concerns about drug use and the likes. But the law has remained the same. A lot of scientific evidence is available at the moment that we can critically look into and draft a policy that can respond adequately to our need at this moment. We don't need to hold on to the stereotype of what has been so many years past, because things are changing. A lot of young people especially are initiating drug use. Many of them are getting sick, many of them are getting incarcerated, and these are the future of our nation. So we need to critically sit down to look into our drug law, to look into our policy, and see how this can really reflect the need to protect the right of every individual, to protect the health of every individual, and to ensure that the young people who are the future of this country have the utmost protection and right to live a healthy and fulfilling life.
My advice to the government is this, that they should also look for work for these people, because most of them, they don't have anything doing. You see them roaming about the street, and at the end of the day, they are maybe Indian hemp smokers, sellers. That's what they trade, that's their business, so you cannot tell them to stop doing their business.
The matter of truth, our drug challenge is not the same magnitude with that of as experienced in some European countries, in the Americas and other Asian countries. But the fact we need to face is that we should take on board what is evidence-based, not sentiment. What is the right thing to be done? Responding accordingly to what works. If for so many years we have done the same thing over and over the years and it's not working, I think it's high time we re-strategize and ensure we bring on board the view of young people, will respond to the issue of drug use among young people adequately to ensure their right is protected and they are free from the risk associated with drug use.
It is important that when we come to changing our policies, revising our policies, whenever that will be, that we need to place that in the context of human rights. We need to place that in the context of scientific evidence. And of course, we need to be compassionate. Somebody who is addicted to any drug requires compassion. He is somebody who needs help. Because he has a disease. Addiction is a disease. So he has a disease like any other disease, and he's not there because he's a bad person. Just like you getting malaria doesn't mean you are a bad person. It just happens to be you, unfortunately, at that time.